Hello, good evening. My name is Lucy, and today I like to discuss a little bit about the situation that we are all dealing with, and that is none other than the corona situation. And I will go straight, I will some other time be able to explain who I am and what I do. But for today, I purposely thought of spending some time because after having stayed home for a couple of weeks and doing some home office, being a mother, and also doing some homeschooling, I came to realize that it's a different time, not because we don't do that in other days or not because we don't have this kind of a schedule with our children in normal days, but because of what is happening. We are emotionally all carried with the situation, and we are all feeling like, wow, it's heavy. It's of course heavy. It's very stressy and making us have difficulties of even thinking how we can overcome and face our tomorrow. Now, after trying to reflect on the weeks that I have been home doing that, what I have to do, I came to a point whereby, well, having dinner with my family, we came to a discussion, and the question was, how are parents with kids with special need managing this? And I, being also a mother of a child with severe disability, I came to realize that even though one is familiar with how one can support the child, and even though one has been doing it, because I mean, if your child is older, or your child has already overcome, or you as a parent, you have overcome the crisis of the first stages of dealing with the situation. Of course, there are some things you considered and say this is what goes or passes or can work with our family. But at this particular moment, we find that everything is completely different. Everything tends to be too much, and we tend not to know what to do. I don't know how to do it. I don't have the resources. I don't have the equipment. I don't have the right person to ask or the right person who can guide me. And this is exactly why I was concerned and said, well, even though I might be repeating what has already been said before or learned before, it's always good to repeat, because through repetition we get to know more, we get to practice, and that's why I thought it's good to have this session with you all. Welcome. As I said, my name is Lucy, and it's a pleasure to be with you this evening, and I salute you all parents outside there. I know even though you're feeling uncertain, that you're really working hard to do it right. And for my dear parents also with kids with disabilities, take it as it is. Try to understand the situation, and before you even think of being unsure and giving up, try to say, when did I have to be resilient before? When did I ever have to be at my best resilient? And if you overcame that point, even this one, you will overcome. And that's why it's a pleasure to spend this time with you all and try to discuss a few things. Remember, we human beings have basic needs. And our basic needs starts not only with love or shelter. It's also the most important thing for all of us, even for our kids with special need, is food, drinking, and feeling loved. And I think that's a very, very important basic need for our children, not only those with disabilities, but also those who are healthy and developing according to that, what we call normal. And considering that food and drinking, I'm going to use very simple terms here so that everybody can be able to understand what we are talking about. And I can imagine we have, like my child, for example, my daughter, she has issues with feeding, she has issues with drinking, and she has issues with choking. So you can imagine what it really means for us to deal with the situation of feeding, and not forgetting that's a basic need. how can one manage, and that we have our kids now 24/7 at home, and not only for 1 day, for 2 days, for 2 weeks, for 3 weeks. Well, we've had this experience during the school holidays, but that is always another time because we have other professionals who are then on our side, who can come home or who we can bring our kids to. But in this certain situation, in this moment, we don't have this kind of external support. That's why we have to work with what we have, with our wholeheartedly try everything that we know, and maybe even try that what we never knew, so that we can be able to help our children. So today I prepared a few things, and considering the fact that we all have to keep safe, we have to keep our hands clean, we have to wash our hands, we have to disinfect our hands. So I thought it's good to start. And I also thought about that child who may be seen to be her ways of doing things is not so like we all could and behave. And that way I mean a child whose muscles are very they are very, very affected and probably cannot be in a position to go and wash their hands themselves. So I thought it's always good to think about how one can do that. And I thought of having some water in here. And in this water, I did put some soap that is not, that is child friendly. And I thought it's good to use the Nr.1. This came into my mind after having a discussion with a mother who said, is it okay? Must we wash hands and disinfect our children who don't even go outside, they don't do anything by themselves, they lay down a lot? And I'm using these terms because that's what she asked me, and I said, well, yes, we have to, because viruses don't know who is walking, who is sleeping, or who is laying down. It can catch anybody, and these children are also at a high risk of getting the viruses, and that's why we also have to protect them. So I thought with this rag, we dip it inside nicely with warm water, of course, and then we rinse the rag and then wipe the hands nicely, like wipe nicely, take our time, wipe between the fingers and wipe accordingly. As a mother or as a parent, you know what your child like, if they like hard feeling, if they like soft one. Like my daughter, she like when one presses her, because I think that's the way of feeling herself and also feeling that something is happening to her. It's a way of of involving contact, and therefore according to how your child like it, you can do that. And after that, after wiping everything that we can put aside, I'm gonna put this also aside, and then after that, the hands we take, after they get dry, we can then take disinfectant, and then we can disinfect nicely our children, starting with ourselves. Hopefully we can help them do the hands like this, with a lot of, depending on what the kids like, whether they like it hard, then we can press them between the fingers and nicely. And the good thing about this, we are not only doing that to disinfect the hand just because of the coronavirus. We are doing that because when you put disinfectant, the hands have a different feeling. The kids feel also some kind of a temperature changes, and that is good also for the training. And this about training, we shall talk about it as time goes by, as we continue connecting. And as you press and massage the disinfectant, then the kids also smell it, and that is also trying to teach kids to use the senses of smelling, of feeling, and it's not in vain. So they learn also a few things during this kind of a process. And after that, now our kids need to eat something. Now, my deepest concern is, for I know this could be a challenge for so many parents. For me, it was a very big challenge. Number one, as I said, my daughter choking, drinking issues, feeding issues, meaning we have to consciously be very, very, very careful with what we do. And drinking was always a big problem. And that's why I'm super, super excited to have some time and demonstrate and teach and show what we did to overcome this kind of a problem. Because we know when a child doesn't drink enough liquids, water or juices or whatever you may want to give your kids, and they are not in a position to drink because then they have a choking problem, then that means that their skin gets very bad. They have a rough skin, they have a tendency of getting wounds, pimples that nobody can explain what they are, and then they also have some kind of a dry kind of skin that no matter what oil one uses, then it's not making the skin look better. And of course they have a problem with the digestion system, which causes a lot of constipation, which is then the biggest problem for our children, because imagine they are not moving around like the other kids. So that is something that we have to consider, because constipation causes other issues, like they are unwell, they can cry, we don't understand probably when the kids are not in a position to verbally communicate, and therefore we have to really be careful about the feeding process and avoiding constipation, as well as trying to help our kids get enough liquids as required for them to become okay during the day. So the first thing I thought is, and this I want to address to the parents who may not understand why doing small things that matters even at home count, because we all have a tendency of saying, I don't know how to do it. There are some professionals who can do that better. I've never learned speech therapy. I've never learned this kind of a therapy that I can be able to support my child. And this is the problem that we are now facing when we are only depending on the school that offer this kind of support, because then we have that problem of saying, I've never done it, I don't know how to do it, I cannot do it, and we give up and we despair and we feel helpless. And therefore the first thing we thought was playing around with our children in the oral area is also a very, very important thing, because kids don't just learn how to feed all of a sudden, and kids don't learn how to drink all of a sudden. Whether with or without disabilities, there are some procedures that have to be followed. And therefore, I thought, for example, if a child is having some kind of specialness and cannot be able to drink as we all expect a child to, then there are some things we have to do, like stimulate the mouth, which is always, those are the first procedures of teaching our children to develop the muscles they need to learn how to drink as well as to eat, meaning that we have to stimulate their mouth, and stimulating the mouth can be done differently. Now we are doing this before we go into the real feeding process, and stimulating the mouth can be through using this kind of cotton wool. You know, I'm using simple things that every family can have, because I considered also some fact that I have some people who tell me, yeah, Lucy, that isn't for me not possible because I don't have the materials, or I don't have those things that you're demonstrating. So I said, I have to try to use things that are affordable and available for everybody, just to try, you know, because when we all think that we have to have great gadgets, we have to have expensive stuff for us to can be able to support our children, I think that is the first thing that will make us give up along the way. And my experience is that small things that make a difference starts from that, using that what you have at home. And this kind of a cotton wool is a very soft thing, and depending, as I said, there are some kids who like hard things, like my daughter, and there are some kids who love soft things, and that way you can be able to stimulate the mouth and the mouth area of a child. I will use myself because I don't have anything else to demonstrate, but I hope you can be able to follow up. And if you have any question, feel free to contact me. I will give my contact at the end of the video, so that you can literally, wherever you'll be watching this video, feel free. I'm your sister and I'm willing to connect, because I also had to go through the same journey many years back. And out of that, I can, at this time of the coronavirus, my point of hope is, if I manage that crisis, I will be able to manage this. Every time I'm feeling down and I don't know what to do, I'm always looking back at my own crisis that I've overcome in my past years, and I'm giving myself hope, because if we have to be resilient, we have to learn that where we have come from, what we have conquered, and out of that we can then learn to cope and adopt. And using this kind of a cotton wool, one can use anything that is of shape. I tend to use this kind of a toothbrush, but even a normal a round stick could also go. If you don't have this kind of a toothbrush, you can use a normal stick, or you can use a normal spoon, a normal feeding spoon, and try to make some kind of a wrapping. And when you overwrap it, all of it, nicely, one can take some water, dip inside, depending, as we said, there are some kids who like it very warm, and there are some kids who like it very cold. And this gives us also the security to know that we will not choke the children and we will not dip it so inside. So using this kind of a thing, I'm going to use my mouth area to demonstrate, because I'm sorry, I don't have anything else to demonstrate, but I hope you will get to connect into what I'm trying to say. And then, for instance, the child has not learned how to do the mouth movement. This is a very good thing to help them learn, because number one, this is a little bit wet, and water is a very, very important thing for our children. Even if they cannot drink a whole glass of water, the minute you put it on the lips of the child, and the child feels, depending whether cold or warm, the child this makes the lips a little bit wet, and that really relieves the child, and then the minute you put it, we may not see, but within that child something is happening. The child is feeling, depending on the temperature of the cotton wool in the water, and the child is also feeling that movement, and somehow, even if you don't see the movement, something is happening, and that stimulates, repeated many times, it will come to a good result. That is number one. And the cotton wool is a very, very good thing. Make sure that they are always clean and well kept before using that. And another thing is also the toothbrush of a child. Assuming this is a toothbrush, I have this kind of a toothbrush because, as you can see here, this toothbrush has some kind of a few things, and this is also for stimulating the mouth. It's not just in vain there. And this used, as I said, this you can put also in the mouth and rotate the fingers very fine and softly. Assuming this is the mouth of the baby, rotate it, and even on the lips, it can't hurt. It's very soft and very nice, and rotating that, it's giving the stimulation of the mouth area. And that is how feeding starts. Feeding does not always start with doing and just feeding. There's a lot of procedures to do before, and these are things that we can do at home with our children. It could be a playing time, it could be a bonding time, it could be an exercise time, because therapy does not only start with those things that we see are being done. Therapy starts with small things that have to be achieved before one achieves the big therapy, that is now feeding and also swallowing. Okay, and that is one, stimulating. We are now about stimulating the mouth area of our children.